Welcome to Impactful Chats, episode 2. I'm Malin Martinez.
And hi, I'm Seth Truger.
And hi, I'm Mark Hertling. Can I introduce myself?
Sure.
Okay. Yeah.
And today we have a very special guest with us, Mark Hertling. Mark spent 37 years in the United States Army and retired as a lieutenant general. Since then, he's done some really significant work helping physicians evolve as leaders and using skills that he learned and cultivated in the military. And an important part of this training that he's done with training effective leaders is coaching them on how to support their own wellness and the wellness of their teams. So given the extra stress that healthcare providers and healthcare systems are under right now, Mark and I have been partnering this week to bring this issue to light using Twitter mostly as our platform. And we're here today to take a little bit of a deeper dive into the guidance that he can offer in terms of wellness for physicians. So welcome, Mark.
Well, thanks, Malin. And Seth, it's good to be with you too. This is going to be, I think, a fun conversation because in a lot of professions, people don't think about crises, dealing with crises, unless you're specifically geared to doing that. And especially in healthcare, it's been fascinating for me as kind of a newcomer to this profession, the healthcare profession, to see how it has affected people, not just the physicians and the nurses who are doing things within a clinical setting, but even the administrators. Here in Florida, you know, we have usually a crisis at least once or twice a summer when a hurricane comes through, but that only usually lasts a couple of days. Now we're talking about a long-term issue, and it's caused a requirement to adjust a lot of the things that all the elements of healthcare are looking at.
Yeah.
Mark, can you start by telling us a little bit about the difference between what you call crisis response mode and normal operations? Because your theory on this seems to really get at the foundation of the stress that a lot of us are feeling now.
Yeah, well, it's interesting, Seth, because in the military, we have something we call deliberate planning. When you know something might happen in the future and you look at all courses of actions to address it, and we actually call it course of actions, COAs, COAs. And you know, if you're saying, hey, someday we might have to defend the nation against an amphibious landing on the shores of North Carolina, then we can plan for that. But with that, you take a lot of information, you take a lot of factors like logistics, where you would put the command and control, what your different soldiers would do. Then there's the crisis action planning, where something happens immediately and you have to react to it very quickly. You know, let's take a look at 9/11. That was a crisis, and the military immediately went into crisis action planning. How do we address the enemy that's attacking us? What do we do to get soldiers there, to get various military forces? How do the logistics support it? What kind of weapon systems do we use? So those two kinds of planning that the military does, it's commonplace for us. We have plans in the Pentagon that are deliberate contingency plans. And then there are things that we practice in war games and in training where you revert to things that you didn't think would ever happen, but suddenly they're upon you. So how do you adjust and adapt to it? And there's a saying in the military that says, whoever adapts fastest on the battlefield will win. So that is always somewhat in the back of our minds. When you compare that to what happens in healthcare, you know, when you're an administrator or part of the C-suite of a hospital, you're going into work every day, you're doing strategic initiatives, you're thinking about capital builds of new hospital buildings or how to order supplies or taking care of your employees, hiring more people. And you don't think about the potential for a crisis unless you're in a scenario where you need to use that. When you're a doctor, really, you know, you can relatively plan your day knowing the information and the science you have about treating your patients. The only time that might be tested is if you're in an emergency room and you have, as an example, a mass casualty exercise or something like that. But emergency room doctors are actually trained to do that. So there's elements of crisis in all kinds of lifestyle, but specifically in the military, it's paramount to how we prepare. when you take a look at all those things and you explain that, you also see, and it gets to your question about stress, Seth, that if you're not prepared for a crisis, it can stress you in a variety of ways. If you haven't prepared to communicate in the right way, if you haven't prepared to fight for intelligence as opposed to just receive information, two different things, and they're generated in different ways. If you're the expert in the subject, like all doctors are on a disease, and you've never been pushed out in front of people to communicate to them in the right way what's going on, that puts an added burden of stress on you too. So all of these things are asking physicians in many cases to do things that they're not normally prepared to do, and that's what increases stress. It's the fear of the unknown and the inability to address things that are coming over the horizon.
Right. That exactly gets at sort of the next layer of the stress that we wanted to ask you about, which is I think you recall leading up to this interview, we asked everyone on medical Twitter, we just shouted out the question. We're going to be talking to Mark Hertling. You can ask him your questions. What has been the sources of your pandemic-related stress during this time? And the overarching themes and the answers that we got seem to fall under three umbrellas, really. That was uncertainty, frustration, and isolation. I think Seth was even one of the people that answered that question.
Right.
Yeah. Yeah, I think the uncertainty, was really a couple of different things. How bad are things going to get? Is it going to overwhelm us? Are myself and my loved ones going to get sick from COVID? Is it going to be my fault for bringing something from a hospital? Or the frustration of not being sure of what to do, or the divergence of opinions on what to do with it, and the isolation, just being separated from family or social distancing from others.
Right. Well, it's interesting because since I left the military in 2013, I've been studying doctors, and doctors are a unique breed of people. Yep. And they're fun to work with, but there's some interesting factors that I think are playing a part in this crisis. Doctors are usually, because they're scientists at the basic level, they rely on science. They're used to receiving information, which can be defined as communicated knowledge, what we know about things. When you're in a pandemic or you're in a crisis, you're looking for intelligence. That's seeking for information that you don't really know whether or not it's out there, and then trying to determine what it means. So when you have a new kind of virus like COVID-19, you're not, and as we've seen, we're not sure where it's going to go next. How does it affect children? How do you treat it? What kind of vaccine can we use? What kind of reaction is it having to different medicine? How is it going to affect not only other people in the community, but doctors and nurses themselves? So that leads to the uncertainty and the continuing question they have. One of the things we had at our hospital, one of the palpable anxieties that a lot of our healthcare providers had was, am I going to carry this home? I'm perfectly fine with treating patients, but man, what if I carry this home to my spouse and my children, and it's putting them in harm's way? So that's the intelligence we didn't have about this virus that's causing some of this uncertainty that you're talking about. The frustration piece, if I can address that real quickly too, it has to do with communication. It's what are you communicating it? How are you communicating, and who are you communicating with? And in my studies of physicians, oftentimes they are very stovepiped in their communications, and they don't rely as much as they should on diverse teams and sharing information. So, you might have a lot of information on your own, but you're uncertain because, or you're frustrated because you're not getting the kind of information you need to do your job. One of the things our hospital has done to adapt, based on some advice I gave them, is they started putting out a daily, what we call in the military, SITREP, situational report. And I said, you got to limit it to one page, you got to make it simple, and you got to pass it out to all the doctors so they know what the heck is going on, and it's not being filtered through nurses or executives or the administration or anything like that. It's a doctor to doctor speak. And that's been going on now. And one of the things I was told just the other day, one of the docs came up to me and said, that idea of a situational report or a SITREP dated every day has really allowed them to track what they've handled. But he also said, we've got to continue that when this is all over, because it's a great way of passing information and communicating among each other.
Mm-hmm. I see. And so can you think of sort of some situations where in the military, maybe when soldiers have told you they felt isolated or felt frustrated, that maybe people were in disagreement about how to deal with what was going on, and sort of what advice you gave them in those situations?
Yeah, it happens all the time, Maylin. It happens in organizations where the leadership isn't and I'll go back to communication. If the leadership isn't communicating continuously, providing updates, telling people what's going on, then yeah, soldiers are going to get frustrated because they don't know what the heck's going on. You know, it's like all those guys at the higher headquarters know what's happening, but we're the ones that have to execute and we don't know. So leaders are trained to make sure they communicate as often as they can. There's always a fear on the battlefield that the enemy might get the upper hand. And that's why, you know, in preparation for going into combat, we continuously train. We do the kind of things in training centers that doctors do in codes. When you execute a code, everybody knows exactly what they're supposed to do. And if a member of the team hasn't been trained, they're quickly pulled out of that team until they learn how to do it. Well, in a pandemic, everybody has to understand what their role is, and that requires additional training and additional communication. So absolutely, those things happen in military units, but we do everything we can to try and overcome that before we get on the battlefield. One of the expressions we use in the military too is, you never want to do something for the first time in combat. You always want to train for it beforehand and make sure you're prepared for it.
Mm-hmm. Yeah, that sounds exactly right. And that sounds like excellent advice. And I think I've seen a lot of that taking place with our leadership at my hospital. But yeah, those are great tips. Seth, any more questions for Mark?
No, I think you summed it up really well. That last bit really resonates, especially with stuff we do for like resuscitation, airway management. Just, you know, you don't want it to be, you know, the first time you do it. And, you know, it seems silly when we do things like sim putting on PPE but
Right.
It's something, you know, you can't do it right the first time when your, you know, heart's already pounding because it's the first COVID patient you're taking care of or intubating or something like that.
You know, that was the thing, Seth, to be honest, surprised me. I was talking to one of our doctors yesterday, actually, and she was telling me, and it surprised me. She said, you know, one of the things that we had trouble with was learning how to properly put on PPE. And I thought to myself, holy smokes, that would be like a soldier saying, I don't know how to fire my weapon, you know, or I don't know how to put my uniform on. And she said, we've got to train more on that when we get out of this thing. I said, no, you have to train more on it right now to make sure you're doing it correctly. So it's just some of the things that are surprising, shouldn't be if you train for it. But a lot of time in a hospital, you don't have the time to train on the most important things.
Yeah, that's exactly right. Mark, you've been such a great source of support and inspiration to the entire medical community during this pandemic. So we really want to thank you for supporting us and for spending these couple moments with us to just get some important information out there. And we're going to be spreading some other good resources for physician wellness for the rest of the week as well.
Well, you've been very kind to me, Maylin, and all the doctors have been very, you know, just kind by inviting me in. And it's been great to share some stories from another profession into the healthcare profession if it provides any help during this very traumatic time. So thanks so much for doing this. And thanks for what you're doing by sharing your music, because music calms everyone. And that's more than anything what good leaders need to do in a crisis situation, is just calm down and take some time for balance. So thank you for that too.
Right, yeah, I'm happy to help in any way I can.
Okay.
All right, thanks for joining us on Impactful Chats.
You're very welcome.
Thanks, Mark.
Thank you, Seth. Thanks, Maylin.